Ever wondered what causes diabetes mellitus and how it's classified? Let's dive right in. Diabetes mellitus, often just referred to as diabetes, is more than just a high sugar problem. It's a complex syndrome, a group of related issues that come together to create a distinct health condition. At its core, diabetes mellitus is a disorder of metabolism, which is the way our bodies use digested food for growth and energy. Now, the issue arises when there's an inappropriate amount of hyperglycemia or high blood sugar levels. This can occur due to either an absolute or relative deficiency of insulin, a hormone that regulates the amount of glucose in the blood. Alternatively, it can also be due to a reduction in the biological effectiveness of insulin. Either way, the result is the same: an overload of sugar in your bloodstream. Now that we've understood what diabetes mellitus really is, let's move on to how we can diagnose it. Diagnosing diabetes mellitus involves looking out for certain clinical signs and laboratory test results. Now, what do we mean by this? Well, the diagnosis of diabetes mellitus hinges on a few key criteria. If any one of these tests comes back positive, a diagnosis of diabetes mellitus can be considered. Firstly, we look for the classic symptoms of diabetes mellitus. These include increased thirst, frequent urination, extreme hunger, unexplained weight loss, blurry vision, and frequent nocturnal urination. If any of these symptoms are present along with a random blood glucose level equal to or greater than 200 milligrams per deciliter, it could indicate diabetes mellitus. But the symptoms alone are not enough. On at least 2 separate occasions, certain test results are required. These include a fasting plasma glucose level equal to or greater than 126 milligrams per deciliter, or a 2-hour 75-gram oral glucose tolerance test result equal to or greater than 200 milligrams per deciliter, or a random plasma glucose equal to or greater than 200 milligrams per deciliter. An HbA1c level equal to or greater than 6.5% could also indicate diabetes mellitus. Yet, in the absence of symptomatic hyperglycemia, a single laboratory test result in the diabetes range isn't enough. A repeat confirmatory laboratory test must be done on another day. This could be a fasting plasma glucose test, HbA1c, or a 2-hour postprandial glucose test in a 75-gram oral glucose tolerance test. With the diagnostic criteria clear, it's time to delve into the causes and pathophysiology of diabetes mellitus. The causes of diabetes mellitus are varied and its pathophysiology intriguing. Let's dive into the etiologic classification of diabetes mellitus. It's like a Pandora's box, filled with a myriad of causes. At the top of our list is type 1 diabetes, characterized by immune-mediated beta cell destruction, often leading to absolute insulin deficiency. Here, the body's own immune system launches a misguided attack on the insulin-producing cells in the pancreas. Next, we have type 2 diabetes, a more complex character. It ranges from predominantly insulin resistance with relative insulin deficiency to a predominantly insulin secretory defect, with insulin resistance secondary to beta cell dysfunction. Imagine your body as a castle, and insulin as the key to its doors. In type 2 diabetes, the keys are either insufficient or the doors are jammed, making it difficult for glucose to enter and feed the cells. However, the story of diabetes doesn't end with type 1 and type 2. There are other specific causes too. Some are genetic defects affecting beta cell function or insulin action, such as maturity-onset diabetes of the young. Then we have diseases of the exocrine pancreas like pancreatitis and hemochromatosis, endocrinopathies including acromegaly and Cushing's syndrome, drug-induced diabetes, and even infections like congenital rubella. Last but not least, certain genetic syndromes like Down syndrome and Turner syndrome are also associated with diabetes. It's like being dealt a challenging hand in a game of cards, where the genetic makeup predisposes one to the condition. Understanding the causes and pathophysiology of diabetes mellitus provides us a comprehensive insight into this common, yet often misunderstood medical condition. We've covered a lot of ground today on diabetes mellitus, from defining the disease to laying out the diagnostic criteria and delving into the etiology and pathophysiology. We've given you a comprehensive understanding of this condition. If you found this video helpful, subscribe to our channel, give this video a thumbs up, and share it with your friends and colleagues. Your support helps us bring more such informative videos to you. Stay tuned for more.